So everyone close your eyes. Picture yourselves in a dark forest by yourself. Everyone left you. All the people you came with, all your friends, they're gone. You're by yourself. You're a little cold, you're getting a little hungry. You hear a rattling in the trees behind you. You turn around, and there's a huge black bear standing up on its hind legs. You hear its growl. It's really loud. It sounds like it's hungry. It's vicious. Its big, white, sharp teeth are staring you down. It starts running towards you. Open your eyes. How did everyone feel? Was your heart beating, like mine right now? Were your hands clammy, like mine all the time? Were you afraid? Did you feel like a tingling in your legs? That's what's happening when we're under stress all the time, to a less extent. So imagine being under that stress and trying to take a test, or having a conversation about Bruce Jenner's interview, or the NFL draft tomorrow night. How much more difficult do you think those tasks would become if there's a big bear growling at you trying to eat you? So like I said, that's what's happening when our body's under stress.
So our body responds to stress through what's called a fight-flight response, controlled by our autonomic nervous system. During this response, our autonomic nervous system sends signals to our brain, causing changes not only within our bodies, but within our minds. This ultimately causes changes with our thoughts, emotions, and behaviors. So as our autonomic nervous system sends out signals, our body responds through chain reactions. These chain reactions cause different molecules to be released throughout our bloodstream that help us react to the stressful situation in front of us. Let me go over a few of these molecules in relation to the bear example that Meredith gave. So first, our body releases cortisol. Cortisol is used to supply our body with sugar so that we have energy to either run or fight the bear. Next, adrenaline is released. Adrenaline plays an important role in our emotions and initiates that fear that we feel towards the bear. Last, proteins are released from our brain that alert us to the urgency of the situation of a bear being in our surrounding. So let's take a step back and look at this from a patient perspective. Although a patient might not be afraid from a bear being next to them in the clinic, they may be feeling stress through different situations such as physical or social deterioration, conflict with interpersonal relationships, psychological conflict, or just a lack of control over their situation. If we are repeatedly exposed to stress, we'll eventually become to the point of exhaustion, and this impairs our ability to heal itself.
So Liv did a really good job explaining everything that's happening anatomically, and now you're probably thinking, la, brain law. What's happening in our patients are things that happen every day, like she said. It may not be because of a bear, but stress happens every day. So what's happening to our patients that we see every day? Their blood pressure's going up. Okay, so now what's happening? They're increasing their chance of CVA, increasing their chance of a heart attack. They're creating little small tears in their vessels. So that's not ideal for healing and fighting off infection. What else? The emotional effect, that's fear. That's throwing off our heartbeat, creating arrhythmias. Not good for cardiovascular. The last thing is how closely related stress is with chronic back and neck pain, which are things we see all day. So stress can either cause these pains because of the postures we then put ourselves when we're not even thinking of what else is going on, or they can just exacerbate the problems that are already happening, or you can be stressed because of the things that are happening. So that's what's happening in our patients. Some things that we've talked about in class that are also related with stress in our patients would be anxiety and depression. All these three things work off each other. They all present each other really similarly, so they're all creating the same types of problems.
Okay, so stress is now considered to be a global public health issue, and yoga is one of several popular approaches used to manage and decrease stress. And recently it's gained widespread attention throughout the public. So yoga is an ancient Indian practice with its roots in the Hindu religion, and it's based on the practices and principles of mind-body medicine. So it began being used as a therapeutic intervention in the early 20th century for a variety of conditions, including neurologic and psychiatric disorders. So there's 3 essential elements of yoga, and that includes posture, breathing exercises, and meditation. Recent research has shown that each of these practice elements has a specific physiological effect. So for the posture is, as the aerobic part, it elicits the central nervous system release of endorphins in the hippocampus and causes an increase in the patient's physical flexibility, coordination, and strength. While the breathing and the meditation component is going to work to really calm and focus the patient to develop a greater sense of awareness and decrease their anxiety and ultimately improve their quality of life. So based on such research findings, now it's the predicament of that medicine must shift from this exclusive biomedical model to a more biopsychosocial understanding of health and illnesses. So, and although it appears that it's a general consensus that we should implement this model, studies show that psychosocial factors are often being overlooked and missed in clinical encounters. So there's a recent study that was conducted to identify potential barriers that inhibit medical students and physicians from implementing these mind-body therapies into their practices. And some of the factors identified include a lack of knowledge of the evidence base of these practices, the perception that psychosocial factors are just beyond our control as clinicians, and that cultural beliefs that addressing the psychosocial domain is just not within that specific clinician's responsibility. So despite that we now have the availability of the evidence to show the efficacy of these things, there continues to be personal biases from insurance companies, healthcare providers, and patients, whether it be the environmental factors like a lack of time, insufficient monetary incentives, or just the cultural idea of the quick fix, which favors that versus the complexity of holistic interventions. So this all influences why mind-body therapies are being secluded from most healthcare practices today, including physical therapy.
So how can we apply yoga and that mind-body therapies into PT? Some key components of yoga are body awareness, postural awareness, and breathing activities, like we have mentioned before. Body awareness is bringing awareness not just to the injured limb when doing PT exercises, but to the whole body in general, and making sure that the whole body isn't getting involved in those exercises. Postural awareness, making sure that our patients have correct posture when performing their exercises, because it is often seen that they injure their back or other parts of their body when doing exercise improperly. And breathing activities, we want to make sure that breathing is increased during exercises and there's not any Valsalva maneuvers or whatnot. And we want to increase oxygen because that decreases pain and decreases muscle spasms. Some emotional aspects of yoga that can be implemented would be minimizing distractions and focusing on the whole body and self. So ways to decrease distractions in a clinic would maybe be like turning off your TV that are often seen in clinics and really then communicating with your patient, asking them how they're doing, because it's not just physically how they're doing, but emotionally how they're doing, so how it really improves their health. Studies have shown that benefits of yoga in treating many chronic diseases such as chronic low back pain, cancer, arthritis, and muscular MS. Let's just do that. As well as psychological disorders such as PTSD, schizophrenia, and depression. Bringing yoga can not only increase one's musculoskeletal system by improving such things as balance, strength, motor coordination, but can also improve healing by reducing stress. One way to implement yoga would be to implement it in a bridge pose, which bridge poses can be done often in clinics to improve like low back pain or core strength. And this therapist, you can see, is trying to make sure that she has body alignment, proper body alignment with her hips, and not one hip is raised higher than the other. And bringing body awareness to her feet and hands, making sure that she's grounding through her whole body, which improves her breathing and improves her posture. So those are just some ways you can implement yoga into physical therapy exercises.
So we want to make sure that we're getting the point across that we talked about stress first, and then we're talking about ways to go around it and work with it, which would be yoga. But we want to make sure that we're not saying like do yoga instead of treatment. It's in addition to. It's breathing in addition to, feeling fully aware in addition to, and treating the person as a whole.